This seminar is for educational purposes only. It is not a substitute for professional medical advice or treatment. Consult with your medical provider for medical advice or treatment. Although the presenters try to keep the information in this seminar as accurate and timely as possible, the speakers and Mather Hospital assume no duty to ensure the seminar is error-free. The speakers and Mather Hospital are not responsible or liable for any claim, loss, or damage resulting from you viewing this seminar.
Good afternoon, and thank you for joining us today for our HealthyU webinar series. Today's webinar is Understanding Opioid Use Disorder. At any time during the presentation, please feel free to enter any questions you may have using the Q&A feature at the bottom of your screen. We'll answer as many questions as we can within the time allotted at the end of the presentation. Your questions will remain anonymous as always. Today's presenters are Dr. Jenna Taglienti, Dr. Jimmy Metellus, and Dr. Andrew Silverman. Dr. Taglienti received her medical degree and completed her psychiatry residency at the State University of New York at Buffalo Medical School, where she also served as chief resident. Dr. Taglienti currently serves as program director for the psychiatry residency program and medical director of the mental health clinic at Mather Hospital. She is also an assistant professor at Zucker Hofstra School of Medicine. She's board certified in adult psychiatry, and Dr. Taglienti has been at Mather since 2016. Dr. Metellus and Dr. Silverman are both Florida natives and received their medical degrees from St. George's University School of Medicine. They're both currently third-year residents at Mather Hospital. And you guys can go ahead and get us started when you're all ready.
Hello, everybody. Again, my name is Dr. Metellus. I'm joined by Dr. Silverman and Dr. Taglienti, and we're going to discuss the opioid epidemic. First off, I would just like to nail across that opioid use disorder is a chronic brain disease. These individuals do not have a choice to be addicted to opioids, and it's something that leads them to have loss of control of opioid usage and leads them to continue using despite the negative consequences. So I just wanted to let you know that people that struggle with this, it's not a choice, it's an illness, it's a disorder, and something that could take over their whole entire life. So during this talk, we're going to go over several different aspects. So I just want to give you an overview to what we will be discussing today. So first off, we'll start off by demonstrating the severity of opioid epidemic. Then we'll talk a little bit about what led us to this opioid epidemic. Then we'll speak on what occurs once recreational usage happens and non-medical usage happens of opioid medication. Then we'll proceed to discuss exactly how this opioid epidemic started. Then we'll inform you on the signs you could look out for to see if an individual is struggling with opioid addiction. Then lastly, Dr. Silverman will go over the treatment and the treatment as well for opioid overdose with naloxone. So first off, I just wanted to demonstrate this chart just to demonstrate the severity of this epidemic. As you can see, the death rate has consistently increased year after year. During the late 1980s and early 1990s, this took a turn for the worse, and we'll describe why that was. But this chart demonstrates how it increased, opioid overdose deaths increased year after year. The most recent data from the CDC shows that in 2020, 71,000 Americans died from opioid overdose. So it just demonstrates the severity of this topic. This equates to about 194 deaths per day. So if you imagine that, that's about a plane crash a day of people dying from this epidemic. So it's a pretty big number. So in 2011, the number actually surpassed traffic accidents. And this was when the CDC declared opioid overdose an epidemic. And as of now, the opioid overdose are the leading cause of accidental deaths in the US. This chart demonstrates a more recent number and overview of the severity of this issue. So in 2021, there was approximately 100,000 deaths from all drug overdoses, which means opioids, cocaine, benzodiazepines such as Xanax. And out of those 100,000 deaths, about 75% of them came from opioid usage, because this chart demonstrates that 75,000 people died in 2021 from opioid overdose. And out of those 75,000 people that were using opioids, 64,000 of them were using fentanyl. So fentanyl became a bigger issue around 2016 for several reasons. One of those reasons, it's a lot more affordable, and it's more widely available, it's easier to be made, and it's a lot more potent. For example, fentanyl is about 100 times more potent than morphine, so it leads to easier overdoses. So like I stated, more deaths are occurring from fentanyl than heroin or prescription opioids. This chart demonstrates that. And again, in 2016, it occurred. But the interesting thing about fentanyl, the majority of the people that are using it have absolutely no idea that they are using it. A lot of the prescription pills sold on the street are actually disguised as, for example, as oxycodone, but in fact only contain fentanyl. And this leads to people taking these pills and not realizing it and making it easier for them to overdose. Despite Americans only consisting about 4.6% of the world's population, we are consuming about 80% of the global opioid supply. And to make matters worse, we're also consuming about 99% of the global Vicodin supply. So this number was gotten a couple of years ago, but it's still pretty recent. So it shows the severity of this issue in the United States. This chart demonstrates how as the opioid sales and as more doctors kept on prescribing opioids, we saw also an increase in the opioid overdoses, but also people seeking treatment. So it showed that we were essentially fueling our own epidemic. So we'll talk a little bit about what led to this epidemic. There was three big factors that led us to this epidemic. One of these factors was that around the late 1980s and early 1990s, physicians were told that they were not doing an adequate job in treating patients that had HIV or cancer. So this led to physicians prescribing opioids more, which was a dramatic difference because before the 1980s, physicians were told that they had to be careful with prescribing opioids. But for some reason in the late 1980s and early 1990s, they were essentially told that they had to adequately treat patients that had HIV and cancer with opioids. So this led to the overutilization of opioids and overprescription of opioids. Another reason which led us to this epidemic was that around the same time, around the 1990s, the American Pain Society pushed for pain to become a fifth vital sign, meaning during every encounter, physicians were not only looking at patients' blood pressure, heart rate, temperature, and respiratory rate, but they were also assessing for pain. But on top of that, they were told to do something about that. So this led to the overutilization of opioids, the overprescribing of opioids. And lastly, one of the other reasons which led to this epidemic around the same time frame in 1996, Oxycontin was marketed as a safe, non-addictive opioid. And physicians bought that up and they prescribed it more and more, despite there being no evidence that Oxycontin was safer than any other opioid. So it further fueled this epidemic. So with all these opioids now in the community, due to the increased number of prescription, it left the community with a lot of unused opioids. And those unused opioids led to people utilizing them for non-medical reasons. For example, some people used it for to get euphoria, or they self-medicated their insomnia, or they self-medicated their negative mood, or it was often diverted and people snorted it and abused it for non-medical reasons. And those individuals, if you ask them where they obtained their prescription opioids, the majority of them obtained it from their family or friend. Some of them got it for free. Some of them bought them from their family or friend, or it was either stolen from their family or friend. And if you further ask those individuals where did their family or friend obtain those opioids, the majority of them obtained it from one physician solely. So what that means is physicians were prescribing opioids for medical usage. However, the unused opioids led to people utilizing them for non-medical usage, which fueled the epidemic a little further. Okay, so once individual starts using opioids for non-medical reasons and recreational usage, some of these people will be able to stop. But what then occurs is that some individuals, whether because they're genetically predisposed or they have environmental factors that leads them to escalate their usage, some of them will continue on using the opioids and continue to escalate their usage. And as they build up a tolerance to those opioids, they will start having cravings for those opioids. And when they stop using, some of the physical withdrawal symptoms will start to present. And when combined, when these opioids are combined with other medications like benzodiazepine, it further increases the risk of overdose. And as their usage continues to increase and the tolerance continues to build up, it becomes more financially challenging for them to continue their habit. They will start off by spending $20 to $40 a day to handle their habit, but as their tolerance builds up and they require more, it becomes financially challenging for them to maintain this addiction. And as this increases, other more potent substances become more appealing to them. Some of them will see heroin or fentanyl being more appealing, given that it's cheaper to buy those substances. For example, fentanyl is very cheap compared to heroin, like I stated. So these individuals, if they're experiencing withdrawal symptoms or they're running out of money, it becomes a lot more appealing to switch over to these substances. And as they escalate their usage, they find ways to get more out of these substances by either snorting it or injecting it. All right, and I discussed this a little bit previously, but fentanyl, the reason why it was the usage was increased in 2016 was due to its affordability, its availability across the United States. And in fact, it was disguised in other counterfeit tablets, and many people that use it have no idea they're using it. And they often find out when they are in treatment and when they get a urine toxicology, they realize that they've been using it all along. So Dr. Silvan is going to discuss how to identify opioid addiction.
Sure. Yeah, so we're going to pivot here a little bit to how to identify if a loved one or someone that you know may be using an opioid and what signs to look for. Also, what you can do about it is what we're going to transition to after. But I hope that that first part from Dr. Metellus, I think, really details how important this has become, especially over the past 20, 30 years. It's really been escalating. So so we'll transition a little bit now into how to identify it. So there's a lot of, so there's about 9 different things that we look for as physicians when we're speaking with patients to identify an addiction. That also details the severity of the addiction. But really, you can boil it down to 3 main components that may make it a little bit easier as, sort of the most important, the most vital portions of what an addiction might be, because it's a term that's thrown around pretty often. So the way that we might look at an addiction would be that someone is using that substance and they're starting to have a loss of control. It's really difficult for them to stop using the substance, to even just reduce their use. They keep having the cravings and they get pulled towards it, which is the second thing to look for, is that they have that strong psychological urge to use that substance. And a lot of times this can even be subconscious, where they don't even realize that's happening. And so then they're going out and they're looking for more of it. And it's really difficult for them to stop without even realizing that. And one of the things that can lead to issues would be those consequences, whether it be legal consequences, sometimes financial consequences, family and friends, they aren't going to as many of those gatherings. So they're just continuing to use even though it might be causing all these issues for them. And that's really when an addiction can be classified as such, as opposed to, and this could be even outside of substance use. I know now we're focusing on opioids, but gambling, food, things like that. And this is just one component, is the opioid use. So we'll continue on with a little bit more about opioids specifically. So when it comes to an opioid addiction, and again, really any addiction, the things that you want to look for in your loved one is, again, really components that we just spoke about, but things that might make it a little bit easier to see is that you see that they're having changes in their personality, their behavior, they're not having that same motivation that they used to have, that same drive to complete things at work or see family. They're all of a sudden becoming more irritable, more agitated, with just a little bit of prompting that in the past wasn't really an issue for them. Again, they're changing their daily routine because now it's starting to form around that habit that they have, or that craving and that addiction, potentially for those opioids. They might start having a lack of concern for their personal hygiene, where they're not showering as much. They're not dressing the same way they used to. Again, maybe they're financially needing more money, even just to buy things like more of the opioids, leading to draining their financial accounts. They may change their friends, change their activities that they do. They're really just changing parts of their lives that they were doing before in order to spend more time looking for that substance and using it. And then there's a lot of different withdrawal symptoms that we're going to go over in a second as well, that you can look for to see if someone was using it and now they're having these symptoms. So when it comes to opioids, it has a very specific withdrawal state. So you'll notice that their moods become lower, they feel more withdrawn, they're not as open and as talkative sometimes. They may start having really these severe flu-like sort of symptoms where they're having nausea and they're vomiting, they're having muscle pains, they're having more tears and crying in a sense. When you look at their eyes, they actually become dilated. The pupils become bigger in a withdrawal state from opioids. So if they're using heroin and then they're withdrawing, you could look for that. They may get goosebumps, which is the piloerection or the sweating, diarrhea, yawning, fever, and issues with sleep as well. Can all be signs that someone might be suffering from an opioid withdrawal. The key with withdrawal that's important to know is that it's not something that's deadly, but it's just extremely uncomfortable. And so that's why going for treatment is important. This way they don't go back to using again. And that's why going to a treatment center is definitely an important component to helping someone through that withdrawal state. So now we're going to transition a little bit over to the treatment portion of an opioid addiction. So for any addiction, in addition to opioids, but really for this talk, I know we're talking about opioids, it should be a multifactorial treatment approach. The first component, especially with opioids, is medications. There's a couple different options we'll go over in a second, but that's an extremely, probably the most important part. There's also counseling, where you can work with substance abuse counselors who can understand, again, some of those portions of cravings and the addiction part that they may not even realize is going on with their financial issues, social, jobs, all those sort of things. And then also getting good support from the community to help them through these cravings, these urges as they come up, someone that they can go to and who can help support them. So for the medications, there's really three main choices, and they come in different forms, but essentially there's Suboxone, Methadone, and Naltrexone. Suboxone and Naltrexone are two that you can get really from most physicians. Methadone is one you have to go to a specific clinic where they have a methadone designation. And that's one that you'd be taking every day that you wouldn't be able to take home with you most of the time. But again, this is probably the most critical component because it's not just a psychological addiction, there's the physical components as well. And so you really need the medications to help them through that part. Without the medication, it's been shown through the research that relapse rates are extremely high and that it can actually lead to overdose and those sort of issues. And also, when it comes to treatment, like we were saying with the counseling part, you want to be in a center where they understand addictions, they can go through that with the patient, they can go, walk them through that recovery process, help them avoid high-risk behaviors and situations, help them figure out how to cope with those cravings if they're going through any of those withdrawal symptoms, how to do that as well. And even within the counseling, they can help them find that community support network. and that's definitely an important component as well, especially when they're in crises and things like that. So in order to find different, things like treatment for opioids, there's different ways you can go online to this website, and they can help you find something that's local to your area. We also have here at Mather, we have the Chemical Dependency Clinic, which is another option for those that are local as well. But there's a lot of different treatment centers that are out there, and so finding something that's nearby where that person is who's struggling with the opioid use is an important component. So next we're going to transition to naloxone. And again, this is, as you see here, for preventing an overdose. It's not the treatment, but it's important to have with you. So the question is, what is naloxone? So it's a spray that can be a life-saving medication, and it actually reverses an overdose from opioids. And these can include things as strong as heroin, as Dr. Martellus detailed, fentanyl being very, very strong. It can help reverse that as well, and even help reverse things like pain medications, prescription opioid meds. And it's given as a nasal spray. As you can see in the picture, it's a 4 milligram spray. They used to have an older version that was 2 milligrams that involved putting it together. This one comes already assembled, and you just simply press down on the cannula, and it'll spray into that person's nostrils who's having that potential overdose. And the really nice thing with naloxone is that if you're not sure if someone's having an overdose, it's okay to give it still. That it's a safe thing to give just to be safe. But the way that you do it is, so it'll work within 2 to 3 minutes. And again, it helps when they're having slower breathing, or even their breathing has stopped. If it is due to an opioid overdose, it can reverse that. And you can get it from local pharmacies, and you can even get 2 at a time, potentially more, from those pharmacies that we'll go over in a second as well. But in order to know when to use it, again, it's okay if you use it if you're just unsure if someone's having an overdose. But some of the signs to look for would be the opposite of what we talked about in the withdrawal state. So some of these would be if someone's having small constricted pupils, they're falling asleep, or they're losing consciousness. And also the breathing is a big component too. If they're having slower breathing and they're not really able to breathe, you want to make sure that you're giving that as well. And so the steps to give it though would be, of course, call 911. So this way you're able to get the emergency help that you need, just in case maybe it's not an opioid overdose, or even for once they start recovering, you want to have help there available as well. Then you want to administer the naloxone after calling 911. You want to try and keep the person awake and breathing. And you want to lay them on their side, because if they're laying flat, they may end up choking if they vomit or they respirate at all, or aspirate. Yeah. And the last step would be staying with the person, of course, until the emergency assistance arrives, to make sure that they're doing okay. And as you can see the picture, when they lay on their side, you want to have their hands under their head to support them, and you want to move their knee over to the side. This way it doesn't go on top of their stomach, and again lead to potential for choking or vomiting, things like that. So where to get naloxone? Yeah, we were talking about this a little before. There's a lot of different places that you can go. And if you go onto that website that's in red at the top, the nyc.gov/health/map, you can look for places that are within New York in order to find naloxone. And again, you can keep this at home. So this way you can always administer it whenever that person is home if there is a concern. And there's those different formulations, but most times today, there's just that one on the left where there's that single step nasal spray. And again, most times it's free, but based off your insurance, there are some times where there may be a little bit of a copay, but typically you can find it for free throughout the city, again, going to that website. And this is that website again. And you can also get training on exactly how to utilize the spray. This way you're prepared in case there is an overdose. And like we were saying before, there's the Mather Chemical Dependency Clinic, where they do have that substance abuse treatment. They do outpatient, where they have counseling. They also have psychiatrists there as well, who can prescribe medications like that Suboxone or that Naltrexone. They also treat other things besides just opioid addictions, but they do that component as well. And that's their phone number, the 631-331-8200. And so, so again, so we were trying to give as much of an overview as we could about, the importance of this topic and what to look for, signs and symptoms, both of overdose and withdrawal, and what to do if you're in that situation. But we're happy to take any questions that anyone may have.
Thank you guys so much for taking the time today to be with us. And that was a very informative presentation. I will actually just touch upon that and say that Mather Hospital is actually offering Narcan training virtually. You just have to register, and you can call 631-476-2723, and we can help get you guys registered for a class if you're interested. So we'll hang out here for a minute or two, see if anybody has any questions. If somebody, let's say there was a suspect that somebody was addicted in somebody's family, what do you guys think would be the best first steps? Would that be to contact someone on their behalf or to try and intervene themselves?
Yeah, so the first step, I would have that person speak to that individual and have them try to see if they see their usage as an issue. The first step is for them to recognize their behavior as maybe problematic or life-threatening. They need to recognize that they need treatment, because it's hard to send somebody in treatment when they don't recognize they need it. So that'll be the first step for that person to do. They'll talk to them, try to speak to them and make them see that they possibly need help and need treatment. So once you do that, then you'll have them be involved in obtaining the treatment. And there's a lot of resources online. And again, Dr. Silverman touched on this. Treatment involves several factors. There's, of course, a medication, but there's also the counseling that's really important. And it's also them being involved in a different community support, because you want them to have people they could talk to that are not using. You don't want to be have them still in contact with people that are continuously using.
Okay, great. A shocking statistic, 80% of Americans are consuming the global supply of opioids. Do you see this use in adolescents increasing? Really great presentation.
Yeah, I think, it's definitely, thank you, by the way. When it comes to adolescents, I think it's definitely a tricky question, because, I don't know if the statistics have been as much for adolescents measured, but, I think that as adolescents are using more substances like marijuana and alcohol, it's certainly a possibility that it could be going up in that population as well. The treatment would be very similar, though, in terms of the medications, the therapy, all those components, and really getting the family involved would be critical as well for the adolescents. But it's certainly a possibility that it could be going up in that population, just like it is in the adult population.
Okay, great. We have a two-part question here, and you're able to see it if just in case I, speak too quickly. What are your thoughts on the impact of insurance payers refusing reimbursement for CAM interventions such as acupuncture or CBT for pain? And do you think part of overprescribing and opioid epidemic could be related to providers not having any other alternatives to managing pain?
Yeah, so insurance, they always are really tricky when it comes to reimbursements, but I definitely agree. We definitely need more modalities of treatment to treat pain. If insurance companies are refusing to provide these modalities, it leads to people utilizing medication, and it further fuels the epidemic. The second part of the question was, what was the second part of the question?
Do you think part of overprescribing and opioid epidemic could be related to providers not having any other alternatives to managing pain?
Absolutely. Yeah, without a doubt. If they don't have other availability to management of other ways to manage their pain, then it makes it that they only utilize the medication instead of those other modalities. I know physical therapy could be utilized for some people. If they don't have access to that, then they rely on medication. So I definitely agree that we do need to do a better job, or the insurance companies need to do a better job reimbursing those other modalities.
What if the adult refuses, they have a problem?
Yeah, so That's a hard one, because if they're refusing, they're not recognizing that it's a problem. And once they're refusing, they're not going to be active in treatment. It makes it very difficult for somebody to get treatment if they're not recognizing that they have an issue. So unfortunately, there's not mandated treatment. You can't per se mandate somebody to get treatment. However, if they start getting into legal problems, and they end up going to court, then the court could actually mandate treatment. So that could be a way for individuals to get treatment that way. But them using is not enough for there to be mandated treatment. So it becomes really tricky and difficult. You have to make them recognize that what they're doing is problematic, and they need to want to get treatment for them to get treatment and for it to be successful.
Yeah, and that's one of the really tricky components when it comes to really any addiction in general, and a lot of mental health, components of treatment is comparatively to a lot of the medical conditions and diseases. People recognize that they have a lab test. It shows that they have this condition, and so we're gonna give you this medication and measure that lab value over time going down or going more to the normal range. But in mental health in general, and in addictions like opioids, the person has to really want the treatment, and they have to recognize that, there's something that they want changed in their life, something that they want to go differently, that things aren't going the way that they want them to. So really, helping them, like Dr. Metellus was detailing, to recognize that, that there is an issue, that this is affecting their life negatively, that it's causing them to, whether it be social issues, financial, legal, family, there's a lot of components that could be affecting their lives, and if they go for treatment, it can help them. And so getting them to recognize that is vital to getting them into treatment and getting them the support that they need.
Has the COVID pandemic increased use of opioids in individuals?
Yeah, so we've seen an increase in the deaths, but this was year after year. We already saw an increase in the number of opioid overdose deaths, but it did increase it further. The recent data show that it was increased in 2021 and 2020. So it didn't make matters any better. People were isolated during the pandemic, so they were left by themselves. And when people are left by themselves without being able to work, it leads to them using more substances. So it definitely made matters worse.
Okay, you guys, I thank you so much for taking the time out of your crazy schedules to be with us today. That was a fantastic presentation. Everybody who's joined today, you'll be receiving a link to complete a brief survey, just so we can give feedback to the presenters and also learn a little bit more about what you might want to learn in future webinars. Thank you for joining us today, and I hope everybody enjoys the rest of their afternoon.
Thank you so much for having us.
Thanks for joining.